innovation that's happened in sensor technology over the last 10 years enables us to do things like be predictive about healthcare, to individual personalized health, to be able to provide trends and insights at a very individual level. And that's been really inspirational.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, we virtually travel to Silicon Valley to learn about a topic that will interest all of our listeners. Everyone should be interested in ways to live a healthier life. I often mention that nutrition, rest, and activity are fundamental. We can all use some help by gaining insights to our fitness and wellness. Today's guest knows a thing or two about building a fitness and wellness ecosystem. We are delighted to have Amy McDonough, Managing Director and General Manager of Fitbit Health Solutions at Google. Welcome to the Business of Healthcare podcast, Amy.
Thanks, Bob. It's a pleasure to be here. I appreciate you having me on.
Well, we have featured Google in some earlier episodes of the Business of Healthcare podcast, and we're really delighted to have you join us. You have quite a story to tell. You were one of Fitbit's first employees. Share some of the highlights along your journey from being a high-tech startup to becoming a market leader at Google Fitbit Health Solutions.
Absolutely. It's been quite a pleasure and quite a journey, as you mentioned. About 15 years ago, about in 2007, Fitbit was founded. Its mission was always to help everyone in the world be healthier, really by inspiration, guidance, and data to help inform behavior. Really, at our heart, we're a behavior change company. But it started out as a really small company. As you mentioned, I was one of the first employees. I had worked with the co-founders at a prior organization, and they asked me to come and help them out on this new journey they were on. And there wasn't even a category for what is today known as wearables. We tried on a lot of different names: smart pedometer, working pedometer, a pedometer with smarts in it. We tried all these different category names to try to come up with what would resonate with individuals. And ultimately, I'm thrilled to say 14 years later, wearables, I think about a quarter of the country, and is wearing some sort of wearables, and they've really become, part of your everyday, and your everyday health companion. So it's been quite a journey to get here, but really thrilled. And I say what still motivates me this many years later is we have the opportunity and the privilege to help everyone live their best life and their healthiest life every single day. And the number of times that we hear personal user stories about their experience and how it helped them get healthy or an early detection of a disease is really inspiring to myself and to the team and to everyone who works on the Fitbit products.
There's always an entrepreneurial component of a startup. And I've been in some myself, and there are times where you think you're going to change the world, and then there are times when you think you're not even going to be in the world anymore. So were there any points of excitement along the way where you had a vision that you might be part of a larger enterprise like Google?
That's a great question. It's certainly a roller coaster. I mean, I think they describe startups in that way with good reason. There were certainly moments where we felt, can we explain the category? Can we explain the need for it? I remember in the early days, we were starting to talk with Best Buy, and there wasn't a fitness, electronics category even. And so they were talking about, well, should we take CDs out, and put in fitness electronics? And so there were some moments where category creation is really new and interesting. But there were certainly some times where we were hearing, again, these early stories from individuals who were just having great success at helping to change their own behavior and living their healthiest life. And we said, if we can get that to catch on, we're really going to be on to something. One of the things that I was most excited about is it was designed as a consumer product, first and foremost, always around health and wellness, but really as something you'd go out and buy as a consumer electronic. But in those early days, even before we shipped the first product, we were hearing from employers, health plans, clinicians, physicians who were saying, I think there's an opportunity to help my patients or help my members live their healthiest life and help them. And so one of my most exciting days was when we made our first, what at the time we called corporate wellness sale. So we had an employer who said, I want to purchase these for all of my employees to help them be healthy because it's important to me. They're going to bring them their best selves to work. So that was a really, for me, very influential day. Certainly the day we went public on Wall Street as a company was a really tremendous day. We helped Wall Street get fit. That was our logo for the day. And it was really fun. And then now to be part of Google, where we have the opportunity to just accelerate and expand our mission with the resources and support and reach that Google has. So again, it's been quite a fulfilling journey, but always comes back to those individual stories.
Not everybody gets to ring the bell on Wall Street. So that's an exciting time. I can only imagine, Amy, as technology changed, looking back, like you said, from 2007 to now, wow, look what has changed in our lives. And I can only imagine that working in that environment with the innovation and creativity of the engineers coming forward and saying, hold on, we have something new. We have something better. And, we all live in this world of technology and this Internet of Things, it's growing almost exponentially. And we're seeing more and we're doing more with these devices. But I think you're alluding to something here. These devices, they're just the tip of the iceberg. It's an enabling technology. Tell us a little bit about the bigger picture beyond the devices that creates value and fuels for this growing market. You're alluding that you had other types of customers instead of just the people that might walk into a Best Buy and buy it as an individual.
Absolutely. And as you said, the innovation that's happened in sensor technology over the last 10 years enables us to do things like be predictive about healthcare, to individual personalized health, to be able to provide trends and insights at a very individual level. And that's been really inspirational. And I think has opened up, as you suggested, new market opportunities for us as well. So as I mentioned in the beginning, we were hearing from employers and health plans and health systems and others about how they wanted to use this technology. If you go back to our mission was always about how do we help everyone in the world live their most healthy life and live a healthier life every day. That's a really inclusive statement. It's also very ambitious. And there is a kind of self-selection bias, as you mentioned, of if it's on a consumer shelf, those who are going to self-select and buy a device, that's one set of the population. And they're probably what is sometimes called the worried well, or those who are very focused on their health, or maybe have a very specific goal in mind. They want to lose weight for an upcoming event. But how do we reach those who really need it the most? Those who are managing a chronic condition, those who are older adults, where we tend to have, increased chronic conditions as we age or increased health complexities. And so that was really the mission that my team took on, which is Fitbit Health Solutions, where we work directly with health plans and payers globally now to make sure that we can reach those who need our products the most, which tends to be those who are focused on cardiometabolic conditions. So those where behavior change can have a really tremendous impact on health outcomes and health impact. Bob, I think you probably know this stat better than I do because I've listened to some of your prior guests, but 80% of chronic conditions can be impacted by changes in lifestyle and behavior. So they can be reversed, they can be managed, they can be improved. And so if we could help people make those healthy choices, the easy choices every single day, and give them really practical and informative ways to do that, we can have a tremendous impact on the health globally at a population level, which is really powerful.
Yeah, I think that, I mentioned quite often I use an acronym. It's probably the wrong one, NRA, but nutrition, rest, and activity. Like you said, if you can manage those things, but that's not an easy assignment to do. Believe me, when you turn on the television, you see this great big pizza with cheese dripping off of it, and you're sitting there hungry, you need a little help here. So my perception I'm getting from you here is it's just not the wearables, but it's other health-related technologies. And I know this market's growing. The whole wearable fitness market is growing, and I see things like activity tracking and heart rate monitoring, sleep analysis. I read that you have millions of members connected to population health platforms. That's a big topic we talk about in our MBA program here with the doctors. A huge number of employers as customers and 100 health plans that you utilize services for. And think about creating a community for those. Let's kind of unpack each of those categories, if you don't mind. And you kind of alluded to, some of the health plans. What are you doing with health plans? How are you building a bigger picture of health-related technologies with them?
Absolutely, Bob. So as you mentioned, strategic partnerships, which you alluded to with kind of the health plans and some of our payer partners globally, are really key to improving healthcare. In order to change individual health, you have to think about the healthcare system, which is really complex and takes a number of people. It's the individual and the everyday. It's the clinicians you might see on a regular basis. It's your informal care team, which is who you surround yourself with. And so we think about not only the individual and personalization, but also the population level. So we have deep expertise at Fitbit and now, of course, at Google on how we reach the consumer every day and how we provide information, tips, guidance to help them be more engaged in their health. And now we know that there's an opportunity to do that in conjunction with a payer and a partner as part of a partnership. So the way those partnerships generally work is that we are now embedded into many plan designs. So as an example, in Medicare Advantage, so your 65 plus population who is maybe managing more chronic conditions or chronic illnesses as they age, but wants to stay healthy and independent. In health plans in all 50 states, there is now embedded into that. You can get access to a Fitbit device and our experiences in our app around behavior change, including things like active exercises, stretching exercises, yoga, etc., as well as all those insights around your data around activity, sleep, nutrition, and mindfulness. And those all come together to make it really easy for them to take care of themselves. And it's really bringing everyday health and healthcare closer together. That's really what our aim is in these partnerships globally in the healthcare space. So older adults is a great population, particularly as we are seeing their adoption of technology growth. We're seeing interest in wanting to kind of stay at home and kind of have that freedom as they age, but making sure that their preventative and proactive care is ready for them to support that. So by giving them tools like a Fitbit device and the experience in the app, you can help support their care and give that guidance actually to the care team. So the care team can have an effective and efficient conversation. Imagine I go in once a quarter and I am going into my primary care physician, or if I'm managing a chronic condition. Now my physician can have access to my Fitbit data and understand how my patterns and trends might have changed and provide me with very personalized information around, well, Amy, maybe you should try going for a walk after you eat, or maybe you should cut out caffeine after noon. Very practical examples that Fitbit, as well as the care team, can provide to help them be more effective in managing their own care every single day.
We call it the healthcare system, but in reality, it's a sick care system. People aren't really getting in front of their situation with their health until something goes wrong. So this is a transformative approach, really, to bring education, knowledge, help, and experience to the forefront. We talk a lot about the social determinants of health. Quite often it's the zip code you live in. And there's a disparity in coverage and help for people. And some of these digital tools and solutions are breaking down those barriers. And I think that's incredibly significant. That really makes a big difference. Let's move on to, what about the employers? Now, I've worked for some large companies before, And in recent years, I've seen them advance confidently with these health risk assessments and programs to get us to do things. Tell us what you're doing with employers using your technology and your solutions.
Absolutely. When we work with employers, their employers understand that their most valuable asset is their employees. Productive, happy, healthy employees are more engaged, and those who take breaks throughout the day and take care of themselves are going to be more productive and bring their best selves to work. And that's important to employers, particularly in the U.S. healthcare market, where, of course, employers are largely responsible for a lot of the healthcare costs for an individual. So there's motivation on both sides, and aligned incentives, which is a big part of how we move from sick care to health care. So when we work with employers, they're often providing a cost share or a subsidization to provide that equitable and easy access for their employees to have access to a tool like a Fitbit to be able to support that Fitbit experience. So they might provide, maybe it's an incentive or a reward. Hopefully it's part of a long-term engagement and wellness program that they're offering. That could include things like a corporate challenge you might run once a quarter that's powered by your Fitbit experience for activity. And those go beyond activity too. You can have sleep challenges or challenges around, it's not who can sleep the most, but it's about the quality of your sleep. So really thinking about how you can build those into the employee experience and make really you're building a culture of health and well-being. So we both do that directly with employers, and we also have a partner network, because I mentioned how we're very partner focused in our approach to health and well-being. So partners who will help run some of those corporate programs, but it's really about empowering individuals with that data and then providing them with that social ecosystem, in this case, in their workplace, to be able to make those healthy choices every day.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Finding a way to motivate individuals. A little side note here. I have a mother-in-law who's 98 next month, and all she talks about is how many steps she's gone, and she brags about it. She actually has a Fitbit, and you go over to her house. She lives by herself, totally independent, and the first thing she does, check this out. She's reporting everything, and I'm going, this is incredible. Now, here's somebody that finally learned how to use, a smartphone, but all ages. I mean, motivating people to get involved. Is there higher demand in any particular age group, or are you finding acceptance in all different categories?
So first of all, happy early birthday to her, and that story is so inspirational. It's great to hear, and those are the stories that keep us all motivated to work as hard as we could to continue to bring innovation to the category. I think to your question, we are seeing all segments really rise in terms of interest in proactive and preventative care and health. Some of that I think fueled by the pandemic, and all of us started to understand our breathing rate and our sleep habits and how important good nutrition was to fade off disease and to live a healthy life. And so I think we're really seeing it across all ages. But as you mentioned, we're definitely seeing that older adults are continuing to want to age healthily and at home, and in their own environment. As you said, she's still living at home and wants to stay there as long as she can. And so we're seeing a strong interest there, but also young people are very much focused, particularly around holistic health. So activity, sleep, and nutrition that you mentioned, I'd add mindfulness to that list as well. So stress reduction, mental well-being, which is such a key topic, as we enter into, we're just hearing so much about that. Your ability to control your emotions, to look at those patterns, exercise is a great antidote to when you're feeling stressed. And so thinking about all of those, and we know that young people are much more aware of their trends these days. Social media plays into that. There's a lot of interesting topics. That's a whole episode on its own. The general thesis is that we're hearing from all segments that there's interest in proactive and preventative care and understanding their own personalized body metrics in order to make the best decisions for themselves. But I'd call out the older adults, and I'd call out, kind of that next generation of younger population as two key ones that we're hearing from frequently.
Well, I can tell you it affects the mental well-being and the mental attitude that I'm accomplishing things. I'm doing the right stuff. It goes well beyond the cardiovascular benefit of going out and doing the actual exercise. I think it really helps establish things. I mean, the other day she told me, she said, "Hey, put me in your will." I thought, what?
That's amazing.
Put you in my will? I'm going to leave first. Yeah, she's going to go over 100 or further. So that's all a very important component there. I failed to mention, we had a podcast. It was a business group of health. I don't know if you know Ellen Kelsey or not.
I do.
They bring in, top 100 Fortune companies, and they look at innovation and ideas. So I'm sure that I was hopeful that you would know her and that they have been a player with you as well. But there's a great podcast out there on her as well. And I thought that was a pretty good connecting point with you guys.
Absolutely. Yeah, we work with a lot of employers of all sizes, and again, globally. And so we've done a lot of work with Ellen and the business group on health team to make sure that there's awareness around how you can use technology like Fitbit to help power and drive those programs and empower the individuals to support their health. So they do some great work. So definitely a listen for that podcast as a recent guest of yours.
Well, just like in the early days at Fitbit, where technology and innovation was thriving, I understand that in your organization today, you have a lot of different areas of growing research. And I saw where you've got a lot of peer-reviewed studies that have been published, using Fitbit devices. And what do you see going forward? Do you see a time where there might be solutions that provide interventions or even some type of diagnosis? If you got blood pressure reading and you're within the range, and you go, okay, you see the doctor, and the doctor says that range is good. And then you go see him again next month. They say, yeah, you're in the range. It's still good. But you don't have the trending information there to see that you're actually trending up each time. Is there new areas of research that are going to empower this technology to do even more?
Absolutely. I think research, we continue to innovate. Innovation is a really important part of our story, and just our culture, the way that we're embedded. And so I would, I think I can take that a couple different ways. One, I would say we're really proud to have more than 1,700 published research studies that incorporate Fitbit, that show health impact and outcomes around things, activity, around sleep, around a number of chronic conditions from cancer to IBS, et cetera, and the power and impact that they can have in driving those results. And there's a couple of really important studies. One is the All of Us study, which is a longitudinal health study that is more than 4,000 participants for several years now that they've followed. And as you said, it's enabling technology like Fitbit that enables that data to be shared for that longitudinal period, in this case, a number of years, which allows you to look at those trends. And they found some really terrific findings. One of those was for every 2,000 steps that you take, up to about 8,000 or 10,000 steps, you're going to reduce your risk of type 2 diabetes by 25%. by
Wow.
walking more, moving throughout the day, which we know has so many other benefits, but reducing your risk of chronic conditions. So there's a lot of terrific research. We also have an internal terrific research team that continues to look at how can we use sensor technology, which is changing so quickly, to be able to do more predictive and preventative care. One of the recent ones I'll speak to is we, over the past year or so, launched AFib detection on the wrist. So afibrillation, a condition that largely goes undetected, especially in older adults. As we age, your risk grows, and largely undetected before you have a catastrophic event like a stroke. And so if you can if you had a test and you were able to detect that heart arrhythmia earlier, or an irregular heart rhythm notification, which we've gotten clearance on from the FDA and from other regulatory bodies globally, we can give you an alert right on your wrist. That can tell you that perhaps you should go get this checked out. Might be nothing, but let's go double check on it. And if we can prevent even one person, though certainly we've prevented more than that at this point, from going through that experience of that catastrophic event, that's really important and innovative. And I think you're only seeing the beginning of that. Imagine if you can combine that with the power of a clinical care. We're not replacing a physician. We're not Dr. Google. We are helping to enable more efficiency and more effective care by providing that in-between visit data, just as you said, Bob. So how can we share that data? Imagine if that data shows up in your clinical record. So the next time you go in, they can see that trend line has changed, a lot more information to be able to make really directed, personalized decisions.
Well, I know the advances in sensor technology has not been totally complete. It is moving forward. I wouldn't be surprised. I'm being a little bit science fiction-y here, but that you could get 23andMe, get your chromosomes off of your Fitbit, Maybe you'll do gene editing off of your Fitbit in the future. Who knows? But the sensor technology is changing all the time because of the underlying technology that supports it. There's no boundaries. I don't think there's any boundaries yet in terms of where we're going. I'm sure there's going to be wearable clothes and a whole bunch of other devices that we haven't even, that we, the general public, maybe you at Fitbit have thought of already, but I think that's going to be pretty exciting. We offer an MBA and an MS in healthcare leadership and management. And one of the courses that we have is an informatics course. And we talk a lot about data privacy concerns and electronic medical records. Do you see a future where we might be able to contribute better data into our own personal medical records and integrate that with some of these electronic medical records like Epic and Cerner, people like that? What are your thoughts along that line? Is that something we should be thinking about going forward?
Absolutely. I think that data can really help inform a clinical visit. And if we can include that data into a clinical workflow, that can be a really powerful tool to help a clinician give really personalized next steps and guidance, right? We've all gone to the doctor and said, well, you should, sleep more, stress less, eat a little less. Easier said than done. But if you can give really personalized experience based, that's data driven and insight and trend given, there's a lot more power in providing something that's very actionable right away and very insightful at a personal level. We do integrations today actually into clinical workflows already, but there's a lot of opportunity to do that at greater scale. And, getting the healthcare system or the sick care system, as you rightly pointed out, to understand the just education around the value of that data and how it can help inform care. Today, we actually provide a PDF that you can actually bring to your physician to share those trends in between those visits if your clinical system doesn't allow you to do that yet. So it's really empowering patients with that data, but we also want to make sure that the clinicians aren't overwhelmed with, hey, can you take a look at my Fitbit data on my screen while we're there? So we really wanted to make that a little easier for the clinician's workflow in addition to empowering the individual.
Well, Amy, when we think of Google, we think of a lot of different dimensions of it. I mean, obviously, it's an amazing organization with so many different capabilities. I'd be remiss if I didn't say the two letters AI. You hear it in the news a lot. And, obviously Google's one of the leaders in that area. How can that fit in? I think of enhanced data analysis. I think of predictive analytics, maybe even real-time monitoring and alerts. Is that going to be a strong part of the future of wearables?
Definitively, yes, Bob. I think you're right. Google is a leader in the AI space. It's been really a core part of the DNA for many years. It's also been a really important part of Fitbit, right? The value that we have in having kind of population level data is that we can help do these predictive trends. So there's already a lot of AI built in and smarts built into Fitbit devices and into those insights. But I think we're just at the beginning of that journey, and there's a lot more that can be done to power those insights, but also connect them to other parts of your experience and other parts of your care. So just to go back to my partnerships example, your blood glucose data on its own might be really interesting if you're managing diabetes. But if you can combine that with your other behavior data, your lifestyle data around your activity, your sleep and your nutrition, and you can look at that all together, you can much more easily spot trends as an individual or as a population. And there are pieces of that all can be done through AI to prompt you then for that next best step and to help you with those trends and insights. Again, at the population and the individual level, I think there's a lot of opportunity and growth, and there's a lot built in, but we're just at the beginning or in the, we're in the early innings if you're a baseball fan.
Well, Amy, we could go on for another hour just touching the tip of all these capabilities. The message we'd like to leave with our audience, we hopefully have enlightened them to a certain degree to look deeper into a better, healthier life by taking advantage of some of these technologies and services that are out there. What would you recommend to our listening audience if they want to learn more and get better insights and take the next step of expanding their knowledge here? Are there things that you can add to the bottom of this podcast that will point them in the right direction, or things you might mention today? What would be your final words on that?
We're just at the beginning of the opportunities to connect everyday health and preventative and proactive health to health care, and to move that from sick care to health care. We have a website, healthsolutions.fitbit.com, that we can add to the bottom of the notes here. And we have a number of the research studies that I mentioned or referenced during the podcast, as well as many, many more, as well as more about how we incorporate both insights at the population level and the individual level, and then more about the ways that we partner with employers and health plans and health systems and governments globally. So would definitely encourage a look at the website to understand a little bit more about what we do, and also just the power of wearables in supporting preventative and proactive health.
I'm so glad we've had this time together. I think back years and years ago when none of this existed. How did people even get by? They just woke up, grew up, and died. Now we have all these great opportunities to expand and do more. So this has been a great, great discussion. We've had Amy McDonough, Managing Director and General Manager of Fitbit Health Solutions at Google. Thank you, Amy, for being part of our podcast today.
Thanks again for having me, Bob. Really enjoyed the conversation. Take good care.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.